Hello guys, today we will discuss about the Tuskegee Syphilis experiment. After World War II, it is also one of the example of the unethical trials. In this experiment, the people suffered from the bacterial infection. This is caused by the bacteria. So in next PPT, we will discuss what is exactly the Tuskegee Syphilis experiment is. Now, topic to be covered, effects of Tuskegee syphilis, the study become public, the end of the study, and reparation. Effects of Tuskegee syphilis. The 1932 study was called the Tuskegee study of untreated syphilis in the Negro male. The study initially involved 600 black male volunteers, in which the 399 with the syphilis and 201 who did not have the disease. Government officially recruited the African American participants in the study of by offering free medical care to them. They were also given free meal and burial insurance. The main recruited were mostly poor sharecroppers from the Macon country and Alabama. The Macon country had a particular high rate of the syphilis cases. These men had difficult lives, owning small plots of land, living in a wooden sacks, and picking cotton in the season. There was little wealth in a Macon country and have a very small chances of seeing a doctor, even though the syphilis was more rampant there than anywhere else in the south. The male enrolled in the study were never told they had syphilis. Instead of researcher kept his information from them and told the patient that they were being treated for bad blood, a local term used to describe us several elements including the syphilis, anemia, and fatigue. In truth, the 399 syphilitic patients did not receive what they signed up for. They were never given the proper treatment needed to cure their syphilis since the government wanted to study untreated syphilis. The doctor was also interested in whether the disease affected Whistle and Black differently. Each time they visited the doctor, the man through their condition was being treated and cured. Instead, however, the medicine provided to them was fake and contained no medicinal properties. The doctors and nurses were not there to cure, but to observe the progress of untreated syphilis. Although originally projected to last 6 months, the study actually went on for 40 years. The entire time, the participants assuming they were being treated. Instead, the government was purposely letting their disease progress for the study. Patients who are untreated sometimes develop no symptoms and sometimes spontaneously recovered, but they can also suffer greatly rashes, skin growth, liver deformities, heart damage, paralysis, insanity, and death are possible outcome of the untreated disease. Penicillin come in use 1947, which could cure the syphilis. Had penicillin been administered to the syphilitic men in the study, many would have led longer and more comfortable lives. However, the government did not treat them. To ensure that the men would show up for a painful and potentially dangerous spinal tap, the doctors misled them with a letter full of the promotional hype, last chance for special free treatment. The fact that the autopsies would eventually be required was also concealed. It was from the autopsies that government would get their final data. The experiment continued in spite of the Henderson Act in 1943. A public health law required testing and treatment for venereal disease, and in spite of the World Health Organization's declaration of Helsinki in 1964, which specified that informed consent was needed for experiments involving the human beings. By the time the study was exposed in 1972, 28 men had died of syphilis, 100 others were dead of the related complications. At least 40 wives had been infected, and 19 children had concentrated the disease at birth. The study became public. Now, in this PPT, we will discuss how this study became the publicly. The story finally broken in the Washington Star on July 25th, 1972, in an article by the Jane Hiller of the Associated Press. Her source was Peter Buxton, a former PHS venereal disease interviewed and one of the few whistleblower over the year. When the experiment was brought to the attention of the media in 1972, news anchor Harry Reisner described it as an experiment that used man being as laboratory animal in a long and insufficient study of how long it takes syphilis to kill someone. Many being to compare the Tuskegee to the appalling experiment performed by the Nazi doctor on their Jewish victim during the World War II. The PHS, however, remained the unrepentant, claiming the men had been volunteers and were always happy to see the doctor, and an Alabama state health officials who had been involved claimed somebody is trying to make a mountain out of a molehill. Study became public in continuation. Under the glare of the publicity, the government ended their experiment and for the first time provided the men with the effective medical treatment for the syphilis. The end of the study. After the Tuskegee study became public, it caused a public outcry that led the Assistant Secretary for the Health and Scientific Affairs to appoint an ad hoc advisory panel to review the study. The panel had 9 members from the field of medicines, law, reason, labor, education, health administration, and public affairs. The panel found that the men had agreed freely to be examined and treated. However, there were no evidence that researchers had informed them of the study or its real purpose. In fact, the man had been misled and had not been given all the facts required to provide the informed consent. In continuation of the end of study, the next points are the men were never given adequate treatment for their diseases, even when the penicillin became the drug of choice for the syphilis in 1947. The researchers did not offer it to the subject. The advisory panel found nothing to show that the subject were even given the choice of quitting the study even when this new highly effective treatment became widely used. The advisory panel conducted that the Tuskegee study was ethically unjustified. The knowledge gained was sphere when compared with the risk the study posed for its subject. In October 1972, the panel advised stop the study at once. A month later, the Assistant Secretary for Health and Scientific Affairs announced the end of the Tuskegee study. End of the Tuskegee study. In Tuskegee wake major chances in the federal rule government governing medicine research were established, including written informed consent and creation of the Institutional Review Board to oversee human subject research. The study also created another legacy. It's become the metaphor for the dis- distrust of scientific research, the risk of government provision of medical care, and the exploitation of the poor patient. Reparations In this preparation, we will discuss about the what kind of facility the sufferer had to be given and for a long time, or what kind of facility given by the government to the syphilis patient, their wives, widows, and offspring. In the summer of 1973, a class action lawsuit was filed on behalf of the study participants and their families. Fred Gray, a lawyer who had previously defended Rose Parks and Martin Luther King, was the leader attorney. In 1974, a $10 million has given out of court settlement was raised. This resulted in only around the $37,000 for survivors. As a part of the settlement, the US government promised to give lifetime medical benefits and burial service to all living participants. The Tuskegee Health Benefits Program was established to provide these services. In 1975, wives, widow, and offspring were added to the program. In 1995, the program was expanded to include health as well as medical benefits. It wasn't until May 1997 the US government acknowledged its wrongdoing during the experiment when President Bill Clinton issued the apology. The last study participant died in January 2004. The last widow receiving benefits died in January 2009. As of 2009, there were 15 offspring receiving the medical and health benefits. Questions for the practices. I have given some questions in this PPT for the practices. These all questions I have already taught in a previous slide. So you can easily do these questions. What is effect of Tuskegee syphilis? So you have to mention all the effects which has happened during the Tuskegee syphilis experiment, all the unethical guidance mishappening and untreated people, what kind of problem they are facing. So you have to mention all these things in the question number 1. Now question number 2, how the study become public. In this question, you have to mention about the publicity, about the Buxton, about the editor and all, how it become popular. So you have to explain all this point. The third one is describe the end of the study. So you have to describe all these things related to the facility, what kind of facility given to the people who is suffering from the Tuskegee experiment, their wives, widow, and offspring, and moral, what was the happened and all. So you have to mention in this third one question. Now discuss about the reparation. In reparation, you have to mention about the government law, what kind of facility they have given to the syphilis patient, the apologize was drawn by the US government, and $10,000 million given to the people who is suffering from the syphilis and their wives, their children. So you have to mention all these things in this fourth one question. If you have any queries related to the question, you are always free to ask me. References. So I have used this references in this PPT. So if you want to just know more about the Tuskegee experiment and what kind of problem they are facing, and you just want to know in a brief manner, so you can also use this references for your betterment. Thank you.